You're live, Andy.
Good morning, everybody. Thank you very much indeed for joining us for this meeting of the Greater Manchester Combined Authority. My apologies for the slightly delayed start. Turning straight to the agenda, in terms of apologies this morning, any apologies received?
No apologies received this morning, Andy. We should have a full composite of members.
Good, thanks very much. Thank you, Sylvia. Item 2, Chair's announcements and urgent business. I will come back to that item in a moment if I may. So we'll defer it for now. Moving on to item 3, declarations of interest to be completed in the way that members Combined Authority are familiar with and return to the Governance and Scrutiny Officer. Item 4, minutes of the Gmca meeting 31st of July. Colleagues, to ask for your approval for those. Thank you. Item 5, Greater Manchester Transport Committee minutes. These are to be noted, the minutes of the meeting on the 14th of August.
Andy, can I just make a comment on that, please?
Yes, please, Brenda. Yeah.
Thank you very much. Just to say how disappointed we are in Tameside of the decision to temporarily remove the services, the rail services between Rose Hill in Marple and Manchester Piccadilly. I'm not sure if you're aware, but that particular line services 2 stations in Hyde, and they are the only town centre stations in one of Tameside's major towns. And we are really very disappointed that that decision was made. Although we do recognise that Transport for Greater Manchester did object to that removal. I'm not sure that it's changed anything at the moment, but it really is a disappointment to us that it means a lot of people who use that service are going to be very much displaced and looking for alternative means of getting into the city centre. So if I can just make that comment, thank you.
No, thank you very much for raising it, Brenda. I don't know whether Councillor Wilson would like to add anything on this. You're live,
yes.
Elise.
Yes, thank you. Only to completely agree with Councillor Warrington on this issue. I think we have seen the same happen in Stockport with the train line through Stockport into Rose Hill Station, and it's at a time when we probably need more provision rather than less, so that people can keep some distance from each other, where we're trying to improve air quality, we're trying to see modal shift. We want to see people, when it's right to do so, be back in the office or be back physically in work. And if we're looking to do that, then we need the provision, we need those trains to run along those lines. And I think there is real strong opposition in Stockport about seeing any reduction, a diminishment of that service, and something we strongly oppose. And like Brenda, like Councillor Warrington, I completely support her comments, really, because I think it isn't that we want to see that happen. And I know, like Councillor Warrington said, TFGM have also objected, but I think this is something that really does need to have a rethink. And if the government are going to do U-turns on stuff, this is one of those things that really we'd be really pleased to see them do a U-turn on sooner rather than later. Thank you.
No, thanks very much to you both. I attended a extremely well-attended public meeting in Marple earlier this year, and it was clear to me the level of concern about public transport in the area, the lack of good quality public transport. So I know how badly this proposal has gone down in that community, but also, obviously, as Brenda has said, in Tameside as well. So you were both right to say that Transport for Greater Manchester have objected, and we've done that through Transport for the North as well. And on the back of what's been said today, I just want to reassure you that I will raise those concerns again with Northern to see if we can have this service reinstated. It is critical to those communities that you've represented well this morning, and we will make a further attempt to see if we can get them to reverse this decision. So thank you, colleagues, for raising that. Should we move on to item 6, the Townhouse project? I'm very pleased to introduce Brenda Warrington to talk about this, because it's a scheme that I think embodies some of our ambitions around public service reform and bringing services together to work as one, particularly on issues like rough sleeping and homelessness. And it's a real exemplar. I was really encouraged to hear about it from Brenda, and Brenda was keen to showcase it to the whole of the combined authority. And I think it deserves that, as you're about to find out. So Brenda, well done to everybody at Tameside on bringing this scheme forward, and over to you.
Well, thank you. And I do appreciate the opportunity to, as you say, to showcase, you know, how proud we are of this achievement now. I do know that all of the leaders have had a range of photographs, you know, via slides sent to them, which I know can't be put up in the public domain because of technical reasons, but hopefully you've had a quick look at the different photographs. But I was delighted to officially open our newest community hub actually in July. We've named it the Townhouse because it's actually been named after one of our local residents, Pauline Town, who has done tremendous work in helping the homeless in Tameside, in particular those people that have been rough sleeping. She's honestly, she's incredible and does such brilliant work for us that we felt that, and she's worked in conjunction with our officers. You know, she's worked on this facility as well. So we were really pleased that she allowed us to use her name, you know, to name it. But it's the latest asset in Tameside's pioneering work to support our homeless. And we're supporting people who homeless in crisis, you know, call it what you will, and obviously to help tackle the rough sleeping difficulties that we know exist everywhere. The facility is located close to the town centre, and it's not just an overnight hostel. It's not just a bed every night. It's more than that. It's a community hub, and it provides wraparound care, support, and you know, friendship to people who are homeless and frankly who are vulnerable. And it's operated in partnership with one of our local churches, which is the parish of St Anne's, and also a charity organisation, Stronger Together Tameside. And it's a new third sector collaboration of organisations as well that work within Tameside. So again, a lot of partnership working now. Forms a wider innovative approach by Tameside's homeless team. And I do want to actually give a shout to two people who have been very instrumental in this actually becoming a reality, to John Gregory and Vanessa Rothwell. They've worked tremendously hard with quite some difficulties, and particularly during COVID and the lockdown, etc. So it has held it up a little bit, but we've seen a significant drop in rough sleeping in the borough. And of course, I think we recorded the highest percentage drop in rough sleeping in England, which was from 42 down to just 5, which was an 86% reduction. And in July, our rough sleeper count was 0, and we were really proud of that. Although I have to say, over the nice weather in August, we've had a couple of people in tents, you know, that have pitched up, but we are engaging with them and bringing them into the facility. And the team's approach, it actually involves trying to tailor the offer to individuals' needs and problems. And we recognise that getting a person off the street is just the first hurdle. it's the ongoing complex issues that people really need support with. And of course, you know, otherwise they'll just go back into the rough sleeping arrangements. And we also help in this hub with drug and alcohol addiction, with mental and physical health problems, welfare rights, domestic abuse, lots of vulnerabilities, and simple life skills. We actually show people how to cook and you know, to look after their own personal hygiene, for example. It really is very basic stuff as well. And the building is actually what was a disused school next door to the church. So it's been developed in partnership with the church, who have been very, very supportive. So again, just referring to the photographs that you've got, the first floor of the building is the overnight hostel accommodation. So we've got safe, warm, temporary sleeping spaces for up to, I think, about 36 to 40 people. But of course, right now, with the COVID situation and the need to make sure that people have those safe distances, we're only allowing up to 8 people per night into the hostel, but other people are being accommodated elsewhere actually. And so evening meals are provided. You'll see in the pictures that there is a very nice cafe area. There's also a private kitchen area where people can you know, do their own things. The ground floor is a shared space used by other charity organisations as well, including a community cafe, and we can prepare food parcels for people, pre-prepared meals that are taken out to people in Tameside, and a food and clothing bank, which I think again there's also a picture of, will operate from the ground floor. Laundry facilities are available. And I have to say a big shout again to the generosity, quite frankly, of local business in Tameside, to retailers, to individuals who have actually donated most, would you believe, most of the fixtures and fittings that you see, the electrical goods, food, clothing, toiletries, all donated to equip the hub and to make sure people have what they need. People have been so generous, and believe me, we really do thank them for that. And of course, we've got rooms available on the ground floor for counselling. So, you know, and there's lots of different types of counselling that goes on. So apart from being proud of the work that our homeless team do, I'm really proud of all our community partners as well, because, you know, they are playing a huge part in making sure that people who are so vulnerable and frankly so desperate at times do get the offers of support, help and friendship, as I said earlier, because I think that's important. People need to believe that they matter, and you know, that they do really. So it's more than just an overnight hostel. It's a community facility, and it's not just a sticking plaster. It's something that is the start, hopefully, of a person's journey to improve their situation. We have already helped many, many people into permanent accommodation, some into employment as well. So we're really pleased about that. So it really is a place that we can help people to turn whatever's gone wrong with their lives, we can help them turn it around. And, you know, we're really proud of it, as I'm sure you can hear. I would like to extend an invitation. If anyone would like to come and have a look at it and have a look round, you're very, very welcome. Just contact me. Andy, we know that you're going to make arrangements to come and see it as soon as you can. But, you know, any of the leaders or officers across GM, if you'd like to come along, we'd be very pleased to show you around. So just finally, Andy, thank you very much for allowing me the opportunity to showcase what we're obviously very proud of. Thank you.
Thank you, Brenda. I think it's an understatement to say your pride was coming through loud and clear, but rightly so. It's a fantastic facility, and feels to me like a perfect exemplar of what Greater Manchester is all about. You know, public services working as one team, working with the voluntary sector, the faith communities, the business community. It's everything we're trying to do, isn't it? And particularly that focus on supporting people who've faced the greatest challenges. So it really is a great scheme, Brenda, and I hope you'll pass back from us congratulations to your chief executive and all the Tameside team that's made it happen. And it couldn't be named after a more deserving person. I gave a Pride of Manchester award to Pauline Town. I know what she does. All of it voluntary. You know, she is an amazing person, and it's brilliant that her contribution to your community is properly recognised in carrying her name on the door. So well done, Brenda. Thank you very much for sharing that with us, and hopefully leaders will take up the invitation. Colleagues, I'm going to go back to item 2, Chair's announcements. I have just one piece of housekeeping first, and that is to approve the appointments of Councillor Brian Shaw from Trafford to the Gmca Waste and Recycling Subcommittee. Hopefully that's approved, colleagues.
Agreed.
Thank you. And then to move on actually to just one statement on the developments in Greater Manchester in the last few days, and particularly overnight. Obviously, we're in a challenging position now with regard to both our efforts to manage the virus, but the situation that we're in with the restrictions that were introduced here just over a month ago. I think it's important for me to say that we have always worked as one here. We've had a cross-party discussion about the issues. We are trying to make sure that at all times we put the health of our residents first, and politics doesn't feature at all, and we've tried to work in that way, and I'm pretty confident we'll continue to work in that way. And we kind of came to a consensus around Wigan, given the cases, that it was right to allow Wigan to be released from the restrictions. Then as the data on Stockport showed Stockport in a similar position, likewise. But last week, of course, we were then discussing the situation in Trafford and Bolton, and it was clear to the leader of Trafford and to the Director of Public Health that the situation in Trafford did not support release. In Bolton, the figures were different. It looked like it did at the time, but obviously they've changed in the last few days. So yesterday we discussed this again, and a decision was reached to go back to the government and ask for restrictions not to be lifted at the start of today, on the basis of what was happening in both boroughs. And I have to say it's disappointing, to say the least, that as of yet the position has not been changed, and it's obviously a position that's causing considerable confusion, because we've had restrictions lifted from boroughs that are experiencing a rising number of cases, but not in neighbouring boroughs where there are a lower number of cases. These restrictions were always hard to explain to the public, but you might say it's becoming impossible given the inconsistency that we're seeing now, and particularly decisions not seeming to follow the data that we've always said we would do. I have to say, I think it was right to ask for the restrictions to be lifted, not to be lifted, as difficult as that would be for residents of both Bolton and Trafford. Obviously, given the rise in cases, but also because there's a lack of alternative measures on the ground in all of our boroughs, actually, to maintain and contain the virus. We've seen in Oldham how door-to-door teams can have a huge impact on bringing case numbers down. And we believe those kind of interventions are the most effective. But obviously, until we've got that resource available to all 10 boroughs, we're in the interim position where, you know, we have to rely on kind of fairly crude blanket restrictions. That's not a good position for anyone to be in, but that's where we find ourselves today. What I wanted to say today is to say to the residents of Greater Manchester, there is, you know, no contradiction in our position. We are unified, as myself and 10 leaders, in wanting now to plan for an exit strategy from this situation that we're in, to move beyond this debate about boroughs under restrictions or not under restrictions. We think we need to move to a new phase, which is based very much on local control of the test and trace system. We think it's right that it's now very much driven by districts in their communities with the resource available to manage the virus. And that would be the first point that we would ask for as part of any exit strategy with the government. Secondly, that we have financial support for people to self-isolate, particularly those on low wages, 0 hours contracts, or those who are self-employed. That remains a major barrier, the lack of funding to self-isolate, to people collaborating with the test and trace, being able to collaborate with the test and trace system. Thirdly, I think we would say that there is a need for more local control of the decisions anyway about restrictions. I think the responsibility needs to pass to the local level, rather than us always waiting to hear what comes out of the meeting, the gold meeting in government on a Thursday. That's not a satisfactory way to proceed, and it's highly unsatisfactory when that meeting is overturning the express wishes of elected leaders of councils in consultation with our Director of Public Health. So we would put it to the government that the measures I've just outlined form the basis of an exit strategy from these restrictions, which we believe are needed for now, but we need to move beyond. The final point of our exit strategy would be that we would continue to ask our residents to minimise social gatherings in the home, because we know they are a particular cause of spread. And with schools returning and the encouragement for people to return to the office, we think it's sensible to keep that advice in place. But as I say, once we've got the other measures of an exit strategy in place, that we then can begin to move beyond the restrictions. It remains our view that the 8 boroughs, excluding Wigan and Stockport, should still be under these regulations, given the situation with cases. And we are now, frankly, waiting to hear from the government as to where we stand with regard to what's happened over the last 24 hours. So it's not an ideal situation, but Greater Manchester is absolutely clear and united on where we think we need to go from here. And I just wanted to clarify that. I don't know if any other leaders would like to come in on this item. Councillor Andrew Weston. You're live, Andrew.
Thanks, Andy. So, I mean, just to sum up where I think that we are at with this, we were told that we would be coming out today. We've not yet come out today. Residents think that we have come out today, and as yet, we've not been advised what the government intends to do to move this forward. This is a total and utter shambles. And you know, over the last few days since we were overruled and I said that I thought that that was the wrong thing to do in line with the advice of our Director of Public Health, I've not exactly made myself popular with residents, because I understand how hard this has been for people, but it is important, even when you know it's not popular, to do what you think is right. And I think the government failed to do that last week, and that has left us in a really unfortunate position in Trafford, having been overruled and having to say to residents, even when the government did not see the case, we thought that was the right thing to do. So, you know, none of us want these restrictions in place. It's about getting rid of them as quickly and as safely as possible when it is the right thing to do. They weren't necessarily the restrictions that we in Greater Manchester would have chosen, but we agreed to them because we accepted the case for action, because we, throughout, have tried to act in partnership. And I think it is a real shame that the same courtesy has not been extended to us consistently by government, I have to say. And so we do now need, as you say, a pathway to exit from restrictions. I am hopeful still that we may see the government, as unpopular as I make myself for saying so, recognise what has happened in Trafford over the last week, which is that cases have effectively doubled and that positivity rates have gone up as well. And it should be noted that cases doubled against a backdrop based on the GM dashboard that I saw yesterday of less Pillar 2 tests undertaken in the previous week. So this is a total mess now. I hope that the government will listen and leave the restrictions in place for another week or two. But we do need to see that localised track and trace. We need to see the funding for hyperlocal interventions. That is our pathway out of this. You know, I take no pleasure in where we end up with and having to with this and having to say to residents that I think that the right thing to do is to leave these restrictions in place for a while longer. We've not been supported by the government in that, and I really, really hope that we receive some urgent clarity today so that we can all move forward, you know, with the clarity of purpose that we've consistently had in Manchester, but with the clarity of messaging from government that we all desperately need as well. Thanks, Andy.
Thank you very much. Thank you very much indeed, Andrew. It's incredibly clear what you're saying, unlike I think what we're hearing at a national level. Obviously, given the position that we were in, the release of the restrictions is obviously the wrong message to send, particularly with schools going back, and you made that very clear over recent days. So obviously what we will seek from here is a discussion with the government to get that clarity and agreement on a way forward. But you know, our phones are on and we're waiting for their call, and we hope that will come. I would like to bring in Councillor David Greenhouse, who I think has had some difficulties this morning, but has joined us by phone. David, can you hear me?
I can hear you. Can you hear me?
Yes, we can, David. So over to you.
Thank you. Yeah, apologies that I can't join you on the screen. Major IT problems just suddenly happened. So just to the picture within Bolton, it's been pretty devastating for us, really, as you can imagine. Last week, I was really pleased to be able to champion that our restrictions be eased. I want to point out right from the start, we've been absolutely data-led on this, and we had a downward trend and going in really the right direction and getting down to some low figures, as low as 12 at one point, and then I think the weekly figures were at 18. And then we saw towards the end of last week a unpredicted, almost unprecedented spike, which took us up to 44 cases per 100,000, and over the last week we've got in the region of 161 new confirmed cases. Obviously we're delving down incredibly into the data to understand what exactly is going on, but it's a very worrying picture, and it would be pretty cynical of me when I've argued always on the data to not recognise that spike. And like Councillor Weston, I know this will have created sadness, frustration, anger from many residents in Bolton who were really looking forward to having restrictions eased. You know, being able to visit their loved ones, some who were ill, being able to really catch up with important people in their lives. So it was not an easy decision, but we had, I felt, a duty to highlight to government at the earliest point that actually Bolton's figures were taking an unforeseen turn. And I feel it was absolutely right to do that, because the juxtaposition of easing restrictions when it looks like now from data that we are currently receiving has Bolton going over into the red reg rating, into the mid to high 50s, and it's of real concern, obviously. And the juxtaposition of that alongside having restrictions eased it is not, we believe, the right thing to have. So we know that we presented the case from not only from Bolton Council, which I have to say had complete cross-party support for this decision that we should not have restrictions eased. So I want to thank all of you. We have a number of parties in Bolton, so all other six leaders confirmed their support for this. So I really thank them for that consensus working. And we presented it from the council, and I know that there was representations, of course, made by yourself and GM. And we now find ourselves in a position where we know that the legal papers have not been presented yet for the restrictions to be eased. and we await, I'm told, an announcement. All this is anecdotal, but we absolutely still believe, although many people will oppose it and many people will think that it's the wrong thing to do, we believe we have to be led by this data and the alarming spike that we've seen. So that's the position in Bolton. We await to hear if government has heeded our warnings. Certainly, we would expect us to, as I say, enter the red rating this week. But I completely support what has been said regarding that these restrictions need to be completely looked at again. And we need to get to a place where we have local targeted interventions. And I have to say the resource and the money to be able to deliver that. And I believe that is the way forward. The restrictions, I believe, are causing a great deal of confusion. And we need to get to a place where we work to, when we get outbreaks, we work to locally contain. And that is where I think we should be leading, and that's the position that I think we should be arguing moving forward. But it's a very sad day for us. We had the support, obviously, of our Director of Public Health, and I want to pay tribute to the team when we asked for restrictions to be eased. But of course, we have to now go with the data that we have before us. And I can't emphasise enough, in the space of 10 days to go from 18 to 56. It should speak for itself in that we have to really be cautious as we move forward. Thank you very much, Andy.
Thank you to you, David, and thank you for the way that you've handled everything over what's been difficult days for everybody. But I think the fact that you have got that level of agreement amongst the different parties on Bolton Council says something, but also that we've got the agreement at this level as well. I think that also says something, that there's no confusion here. We know what we need, and we hope the government are listening. I don't know if any other leaders would like to come in on this. I can see I'll bring in Sir Richard Lees and then Councillor Elise Wilson. Richard.
Thanks, Andy. Have I got a red thing? I can't see whether I'm live or not, but
yeah, I think it's just took a while, Richard.
Yeah, I can see it now. Yeah, it's okay. I think I just want to make a couple of comments, and I'll start with what Councillor Weston said, in that we went along with government proposals because we recognised that there was a need or a case for action. But also take what Councillor Greenhalgh said, which is that we need to be evidence-led. And the evidence we've got so far shows that those measures that were imposed by government a few weeks ago, frankly, are not working. And it's the sort of approach that has been taken, I think, earlier in Rochdale and then in Oldham, that are having an impact and are making a difference. But what's described as the local lockdown isn't making a difference, partially because nobody understands it, and it is being very, very widely ignored by literally tens of thousands of people on a massive scale. But if it's a case for action, then we need to think about what is the problem that we are trying to solve. If the problem is eradicating COVID-19, then we're not going to do it through lockdown measures. It will be done through a vaccine. It will be done through cures. It's not going to be done by what we're doing now, and that's what the evidence says. And that means that until we've got a vaccine, until we've got a cure, what we're in is trying to manage the situation rather than eradicate what we will not eradicate. And if it's about managing, then we need to understand the circumstances we're in at the moment. I'll just a couple of figures, and I'll compare now with a couple of figures from April. In April the 27th, the SITREP that we use on April the 27th the number of people in non-ICU beds in our hospitals with COVID-19 was 827. It's now 69. If we look at deaths in hospitals, we can only compare deaths in hospitals over because we weren't recording nationally a lot of the data around deaths outside hospitals properly at that. If we compare deaths in hospitals from COVID-19, April the 27th in Greater Manchester, it's 237. Last week it was 8. Now 8 is obviously it's still eight too many, but we need to compare that with what else is happening within health in Greater Manchester. We need to compare that with what's happened to mental health, where we're having an explosion of people with mental health problems. We have to compare that to the thousands of people who have delayed treatment, and delayed treatment in many cases for life-threatening illnesses, and what the impact on them is. MRI alone used to do 2,000 operations a week. They've been doing virtually none now for 6 months. What impact is that having on people's lives and their life expectancy? We have to factor in the economic damage, and not just what it's doing to other people can keep their job, keep a roof over their head. We know that economic damage also reduces life expectancy as well, and we need to factor that in. And we have to factor in other diseases, including other infectious diseases, where I believe at the moment more people are dying of summer flu than they're dying of COVID-19. All of that suggests that we need a balanced and proportionate approach, and something that is very, very different to what we have been doing over the last few weeks. And the discussions that have taken place over the last few days between Mayor and leaders have started to set out, in the way that both I think David and Andrew have described, a new approach to managing COVID-19 that is localised, that is proportionate, that is very much targeted. I think we have to work that up in a very robust way, and to be able to present that to government about saying, look, we have a solution that can succeed in managing this in ways that other ways aren't. Because if we don't do that, actually, I think we're going to end up causing far more damage in all sorts of ways than we are going to do in terms of solving any of the problems we face.
Thanks very much, Richard. Very clear, and obviously we hope the government will accept what we're saying. So I had Elise Wilson who wanted to come next. If any other leaders could indicate to me, I'd appreciate that. Okay, Brenda. Elise first, then Brenda.
Thanks, Andy. Yeah, I did want to come in, and I am supportive of the broad approach. Obviously, I'm really keen to ensure that the agreement that we got for the easing of restrictions in Stockport happens and continues, and that the regulations, if there is a question mark over that's resolved. I think that is the right thing to do, and we had again cross-party support both at local council level and across all of our 4 MPs, and together with the combined authority and yourself, Andy, and so we've shown with that evidence base that Councillor Greenhalgh was talking about, that the rate in Stockport has fallen, and that is thanks a lot to the work of the people of Stockport, sticking to the rules, but also about Stockport, how we've taken an enhanced local approach in Stockport, really targeting our interventions to where we've known or where we've seen increases in a really local level way, and we have a robust outbreak management plan that we use to really ensure that going forward, whatever fluctuations we might see in the future, and there are likely to be continued fluctuations, as Sir Richard Lees has said earlier, you know, this isn't going to completely disappear just by having lockdown. So we know that there will be fluctuations going forward, but our outbreak management plan and our enhanced local approaches will help us keep control of that going forward. I think it is really really important that we take the holistic view, and that's what we're trying to do in Stockport, a real balanced approach to the different problems or issues that people face in Stockport, and really making sure that we put people of Stockport at the heart of what we're doing, really thinking about what are the difficulties they're facing, what are the challenges within their lives, what are the outcomes that we're hoping for, and how do we make that happen. And that's why this enhanced local approach with a robust outbreak management plan is the way forward to go. And I am absolutely convinced still that the right thing for Stockport is that Stockport's restrictions are eased, and that we move forward into this more holistic view and local enhanced interventions. Thanks, Andy.
Thanks, Elise. I think yourselves, Alderman Rochdale, have proved that the enhanced local approach is definitely the way to go. Other boroughs have obviously been doing the same, but we want to really go in that direction now, and you're absolutely right about that. I've got Brenda next.
Thank you very much. Can I just say, I won't repeat everything that's already been said, but fully endorse and agree with the comments made by Sir Richard Leese and Councillor Wilson. We also in Tameside are finding that people, because of what has happened very recently with the local lockdown situation, the very mixed messages, the confusion that has reigned has been quite incredible, to be quite frank with you. People really don't know what the situation is anymore. They're also finding that government appear to be a little illogical in the decisions that are being made, particularly around, as an example, small business that is still prevented from opening because of the local restrictions, such as some of our leisure facilities, our beauticians that offer facial treatments. They're not allowed to open like others across the rest of the country, and they are finding it very, very frustrating. And as Councillor Wilson mentioned, the economy suffers for them as well, and they are desperate to get their business up and running again, but are prevented from doing so for reasons that they really don't understand. In Tameside, like other areas, we have been doing quite a lot of targeted interventions, and it is proving to be very successful. We have outreach teams. I got involved with one just last week, just talking to people randomly, in our market squares, civic areas, parks, etc., and talking particularly to businesses, helping them to display the right kind of messages to members of the public that go into, particularly into shops, etc., to wear face coverings, keep your distance, etc. And generally, people are very, very supportive and do understand that. What they don't understand, because certainly the social distancing, the facial coverings, and washing your hands regularly, people understand that. They get that. It does work. It's proved to be working. The other, don't mix with other households. Don't let anyone in your garden. It really does seem absolutely illogical and ludicrous when they can go to the pub and mix with those very same people, as an example. And so, people are questioning the logic. We know that our localities will react to sensible precautions. We know our localities, and we know the best ways to advise in the areas that they may well need some extra advice. We're in the schools. They're all prepared now, ready. A lot of them today, are opening, and they're all very, very ready and very keen to take those pupils back into school. And we don't want to sort of wreck that at all. So we don't need the confusion. We have to have control in each, I do believe local control has got to come back into play. It really is not not helpful for government to be intervening, you know, from down in Westminster. They probably never even heard of Tameside, never mind anywhere else. And yet they're telling us what we should and shouldn't be doing. We do very much follow the evidence base. We follow it very, very clearly, and you know, we react to it as appropriate. And I think that definitely that broad local approach, you know, sort of overseen, you know, from a Greater Manchester aspect, is the one that we need to follow, and we can be responsible for doing that because we know our people. And I would appeal, Andy, certainly. I know that you're, you know, trying your best to get that message over to government. I just hope they listen, because this is the only way that we will, as Sir Richard says, we will manage the COVID situation that we're facing. Thank you.
Thanks very much indeed, Brenda. I don't know if any other leaders wanted to come in. If not, I will just sum up. You mentioned, Brenda, hoping that the government will listen. Well, it would seem that they are, in that the Health Secretary has now just announced, I understand, that the restrictions won't be lifted in Bolton and Trafford after all, but will be lifted in Stockport, which is obviously what we communicated to them. The issue here is the confusion all this is causing, isn't it? Obviously, we think that finally is the right decision, but it's the damage that's done in getting to the right decision. And I think, Brenda, you're absolutely right to say we now need to make the decisions in consultation with the government, but you know, we now need to kind of move beyond this phase that we've been in, because it's not helping anybody, not helping the government. We've got to move beyond crude blanket restrictions that have an impact on people's lives and on people's businesses. And we do need to move towards targeted, funded, high impact door-to-door interventions of the kind that David Greenhalgh was talking about, alongside the other support that we think we need for self-isolation. The restrictions can only be an interim measure now. You know, we need to now be planning to move beyond them. And that discussion needs to begin in earnest with the government today. We can't carry on in the kind of place that we've been over the last few days. This is too critically important. People's health is at stake here. We can't be sending these messages out to the public where they don't know where they're working. We're clear. We will keep articulating that clear message to the government. Let's hope today, having finally got to the right position, that we can use this as a sort of drawing of the line and the start of a new phase. We will see. But you know, it's not been a good few days, and the government, I think, needs to start to listen to yourselves as local leaders, as people responsible for the health and well-being of your communities. If they start with that and go from there, then I think we'll end up in a much better place. So thank you, colleagues, for your contributions. It was important to spend a little bit of time on that. If I may, let's move beyond that issue, but into a related issue, which is back on the agenda, which is our 1 year living with COVID resilience plan. It does follow actually from the last discussion. Leaders will know that this is a plan we've been working on for some time. You know, this is a plan that is very much about the interim period we're living in, this time before we have a vaccine and an effective treatment. But as Sir Richard Lee said, where we want to, as much as possible, bring people back to school, to the city centre. We want to bring as much Greater Manchester life back as possible, as safely as we can, and at the same time address some of the impacts that we've seen from COVID on people's mental health and well-being, as Councillor Wilson was saying, learning the early lessons of COVID, what things have actually worked well and what do we need to keep from this period. What are the big issues that need quite urgent attention if they're not to cause long-term impacts on inequality. We're about to come on to a discussion on young people and the impact that this crisis had on young people. We're delighted that Diane McDowell, the chair of our task force, is with us today. You know, we need to think about young people in this moment and things that need to be done now to stop them suffering quite profound impacts later in life. We've seen the A-level crisis over the summer. What we need to understand now is what do young people need to make sure that they are not impacted next year? What's the catch-up provision that we need to provide? There are issues around digital exclusion, given we're showing this morning how more and more stuff is being done online. Yeah, well, people who don't have access to digital means of communication are facing even potential greater exclusion, and that needs to be addressed. Food poverty is an issue for many of our residents, and we're proud, of course, that one of our own, Marcus Rashford, is leading a concerted effort now to address issues around food poverty following his earlier interventions. But we want to bring forward a plan ourselves so that no child goes hungry in Greater Manchester. So the plan that we've got before you this morning is very much about this interim phase of living with COVID and beginning to lay some foundations for the recovery and building back better that comes beyond this interim period. Of course, it is all based on test and trace, and the plan very much references a fully functioning, locally controlled test and trace system as being an absolutely critical foundation of everything in this plan. So, colleagues, you're familiar with much of the detail in it. I'll take you through the recommendations in a moment, but I'll just ask Simon Noakes to see if there's anything else, Simon, that you think you need to draw to leaders' attention. Simon?
Thanks, Andy. Not really. I guess just a couple of points just to emphasise. I mean, it is, as Andy says, it's very much a kind of bridge between the current GMS and the new GMS that we will produce. Greater Manchester strategy that we will produce next year. It is therefore very much a living with document. It's not our kind of economic recovery plan. It's not a kind of big pitch to government for lots of money or anything like that. It's very much a kind of what we think we need to do based on the learning and lessons that we've already identified, and one of those big ones obviously is inequalities, and that comes through loudly in all the work that the Recovery Coordination Group has been doing, and it's obviously set within the current context of the ongoing issues of COVID. I think just kind of briefly say, obviously in the middle of the document there is a sort of heat map, as we've described it, of the kind of the impacts that COVID has had, and then a list of deliverables that we think is going to be important for Greater Manchester to focus on in the next 12 months as we live with COVID, but as we start to rebuild Greater Manchester to life. I mean, we've got identified kind of lead agencies for each of thinking about each of those deliverables, recognising though that all of the actions will require cross-agency and cross-organisational actions. So there's a lead agency, but then a raft of other actions that need to be taken as well by supporting agencies, and those cover both social issues and economic issues and environmental issues. Some of the examples that Andy's already mentioned, and things like the work and skills recovery plan. Things around the role of the voluntary community sector moving forward, things around the social value framework, which we're going to come on and talk about in a little bit later, things like the community hubs that have been so important through COVID, and also things like the Good Employment Charter and the kind of support sectors of the economy, particularly the cultural sector that's been so badly affected. So it covers a raft of this year issues, and then that's, I suppose, about the what we need to do. And the recommendations in the report specifically then talk about how we might do that, and focus on sort of three areas, which I know, Andy, you'll come to, but really about how we think about economic, social and environmental issues in inequality issues in all the decisions that the CA makes, how we strengthen the role of the portfolio in thinking about analysing and reporting on some of those issues, and how we look at whether or not the use of sort of minimum standards or targets in each locality, each neighbourhood, would actually support the effective targeting of resources, recognising that actually inequalities in any community in Greater Manchester affect the whole of Greater Manchester life. So I'll leave it at that point. Thanks, Andy.
Thanks to you, Simon, for all of your work on this. So this is a really high quality piece of work now that will guide us through the next year or maybe longer. We don't know, but it's right to have this plan in place to minimise the impact of this virus on our residents, particularly young people, and as I say, wanting to make sure that we get that catch-up provision in place for them so that we don't leave them permanently damaged by this time that we're living through. So the plan is laid out, colleagues. You will see a heavy emphasis in the recommendations that we're asking you to agree this morning on equalities issues, understanding that the virus has shone a spotlight on those issues. Brenda has done a fantastic job in strengthening the governance around the age-friendly and the equalities portfolios, bringing together the new panels that we've established. And of course, the targets idea that Simon's put forward is about that equity across all communities in Greater Manchester. So that very much is a driving theme of this plan. I'll open the floor, colleagues, if anybody would like to contribute. If not, it is very familiar to you all. It's a good basis now for us to approach the challenges of the autumn and the winter and beyond. So, colleagues, if I can ask you to agree the recommendations and then adopt the Living with COVID Resilience Plan. Thank you very much, everybody. Hopefully turning to slightly more positive matters now. Build Back Better, the idea of a young person's guarantee. As I said before, we were absolutely delighted when Diane Medall agreed to chair a task force on what we might do to build a young person's guarantee. We're grateful that the government has acted around the Kickstart scheme. That's certainly something that will help young people in this time. But we need to see things more in the round. You know, we need to consider young people's mental health and well-being, the impact on their education. As I said moments ago, food and obviously the issues that Marcus Rashford has been raising, skills and training, the cost of travel. There are lots of issues here that we need to look at to make sure we're supporting young people in the round. And I'll introduce Councillor Sean Fielding just to talk about the the notion of a young person's guarantee and the emerging approach to that guarantee. And I'm sure then Sean will invite Diane to address the meeting on her findings and her thoughts so far. So Sean, shall I start with you and hand over?
Yes, thanks, Andy. I only intend to be brief because I know that an incredible amount of work has been undertaken since the last CA meeting, where we had to defer this item so that we could ensure that it was going to be aired publicly and we could really showcase the work that we were intending to do at the time, but we have been able to get on with since. Of course, the idea of a youth guarantee grew out of the findings that we've seen, whereby young people are disproportionately affected by the current economic slowdown and situation. We know that the shutdown and furloughed sectors, sectors which sadly, as furlough wraps up, are probably going to see significant amounts of redundancies, are disproportionately staffed by young people, and so the effect of the recession that's been caused by the coronavirus crisis will disproportionately affect young people in the same way that many recessions have done in the past. Now, we're determined to do something different, and in addition to and over above what the national government is doing to support young people, and that is where the idea of a young person's guarantee came from. And I'd just like to say thank you to the CA for agreeing the recommendations last time, so that the work could be undertaken, and so that Diane and the team at the CA could get on with what they needed to do to make this happen. And we're just really pleased to be able to bring it back to you today. I want to say thanks to the team again, who have put so much effort into making this work and getting their ideas together, and how we are going to support young people above the way that that the government says it intends to support them at a national level, and demonstrate how we do things differently in Greater Manchester. But in terms of the detail and in terms of that work, I think the best thing that I can do is just to hand over to Diane and allow Diane to take us through it. We are really, really fortunate to have Diane chairing the Young Persons Task Force. Diane, as many people know, is a former Olympian and Commonwealth gold medalist, and she's been supporting disadvantaged young people through work, through sport and engagement activities since 2002. I think the danger is when we do things like this ourselves, corporately, with politicians or just officers of the CA, that we don't reach the harder to reach young people, and we don't reach as many people as we would like to. So having somebody like Diane, who has that kind of profile and has the connections that Diane's built up over time, is so valuable to the work that we're trying to do. So I'll leave it there, and thanks again to the team and to Diane, and over to you.
Thank you, Sean. I appreciate that and would like to also add my thanks to the team who have been working extremely hard to enable the guarantee to begin to shape what those recommendations look like. Thank you also to you, Andy, for the opportunity to chair the Young Persons Guarantee. And what I'd like to do is update you on 3 key things. The first is the Young Advisory Group and the role of the group, what we've been doing and how far we've come. The second is the proposed draft plan and how we've come about shaping that plan, where we're up to and what still needs to be done. And the third is about how we are developing the themes around the task force, the work that the task force will do and what that looks like. Our vision for the Young Persons Guarantee is that no one gets left behind. Just listening to the conversation that has been taking place, it's very clear and becomes even fundamentally clearer in terms of why a guarantee is necessary, particularly from a young person's point of view, when you think about the confusion and the communications and the inconsistent communication that exists at the moment. So on the Young Advisory Group, we have now identified 24 young people who sit at that as part of that group, 11 to 30-year-olds. We had 90 who applied to be part of the group, which we thought was brilliant in the space of time that we had. We shortlisted to 24, and each borough, bar Manchester, has 2 representing each borough, 4 from Manchester, because what we wanted to do was take on a further 2 from the Youth Combined Authority, so we had that balance there. The role of the group is to reflect the consultation. So reflect and deliver on what we have heard, what young people have told us, and help develop a plan from that. As a result of developing the plan, it's clear that within our 4 themes, which I'm sure you're familiar with, but let me just give you a little bit of context. It is around keeping connected, so that's about access and inclusion. It's about staying well, mental and physical health. The third area that the group are focusing on is preparing for transitions back into education. And the last area is preparing for, removing economic barriers and inequalities. And what's emerged from those 4 themes are 3 phases. So phase 1 is what we are calling identifying the offer. So what we've done since I've been appointed, so since June, is identify what are our current assets, what's already out there, and how can we embed that? How do we maximise the current offer? But also, how do we adapt it so that it is relevant now? So phase 1 is very much about awareness, engagement with our current partners, and looking at how effective our current offer across GM is at the moment. We've now moved into phase 2. Phase 2 is about development activity. So this is where we are beginning to identify and develop new programs and initiatives that can be delivered back to young people in the medium to in the short to medium term. So the whole of this month is about continuing to work with our partners, listen to them from business, education, digital and health providers, and understand what is the tangible commitment that they can offer in terms of that development activity. So we've listened to the young people, we've got a level of understanding of what the challenges are, and how can we now begin to develop initiatives that speak to those challenges. So that's what we're doing for the whole of September, identifying those initiatives. The third phase is what we're calling structural change. So this phase focuses on identifying what further support is needed and what investment or resource is going to be required in order to develop that structural change. So phase 3 is very much about legacy, really. We know that the virus isn't going anywhere quickly. So as a city region, we need to have that long-term plan that fits in with what we've just seen there in terms of our response to living with COVID. So that third phase is very much around that. So in terms of the second part of what I want to share with you, the draft plan and how we have enabled the consultation to identify what the priorities are and how those priorities are now being worked up into proposed activity. So for example, in that Keeping Connected theme, young people have told us that they want the task force to focus on securing better internet access. They want better access for disadvantaged young people, which is huge on the agenda. We hear it all the time, don't we? They've told us that they want availability for free or subsidised public transport, particularly for those young people who are continuing to remain in education and training over the next 12 months. And they've also said that in Keeping Connected, they want us to ensure that there is an alternative to travel options for young people. So, for example, improved cycling schemes. So looking at the priorities that have come through in this area, we have now developed what that proposed activity might look like in phase 2. For example, immediate availability of distribution of Wi-Fi devices to digitally disadvantaged groups. We've looked at how we promote technical support, or what our offer looks like for those digitally excluded young people. And we are beginning to map out how do we work with TFGM and other transport providers to explore the creation of safe travel spaces at certain times, safe use of public transport and opportunities to cycle. If I then go on to talk about what that looks like from Staying Well, what they wanted us to do in terms of this theme is improve access to mental health support for young people who are not in education. And as the conversation has broadened on this, what is coming out very clear is we have to do more for our young people in terms of that mental health support, resource and space. So, for example, what we're hearing from the Young Advisory Group is, although there is some great work being done by the children and adolescent mental health services, where those services are accessed needs more thought. What young people are saying to us is they're expected to be vulnerable and expose some of their needs in a place where they're also expected to be confident and ambitious, which is school. So what they're saying to us is a little bit of a disconnect in terms of being able to have the right place at the right time to talk about some of those mental health challenges, and we need to relook at that. So our proposed activity, for example, in terms of Staying Well around mental health, will be providing positive engagement opportunities for young people to feel safe and to share what's really going on in their lives. They want opportunities to be part of the agenda around social action and be empowered to make a difference. So this is how we are beginning to develop the proposed activity as part of the guarantee. If I move towards effective transitions and share with you some of the priorities that are coming through there, they've told us that we need to ensure that young people are not disadvantaged by the fact that they've missed their education, that their aspirations to get a good job, to look at what their career pathway might look like now. They want to be assured that they're not going to be disadvantaged there. They also want to be assured that there's going to be increased access to financial literacy and life skills curriculum in schools and colleges. They want to be assured that support is available for all young people interested in entrepreneurship and self-employment. So what does that look like when we begin to map out the proposed activity? What the team have begun to shape is that opportunity to ensure that no young person gets left behind. And what that means is that we are using Gmca, the Greater Manchester Apprenticeship and Careers Service, as a soft landing point for our young people so that they can begin to access advice, have their questions answered in an already established opportunity and platform. But what we're doing there is repurposing some of the information on there so that it is relevant for all our age groups, our 11-year-olds right through to young people who are looking for a job or nervous about being made redundant. And just finally, on the fourth theme, which is around how do we narrow the gap when it comes to those economic inequalities. What we are hearing loud and clear from young people is they want equal opportunities and access to jobs. They want to be able to work with employers who understand culturally some of the challenges that they face on a daily basis. And they want us to develop routes, mechanisms that increase job security. A big ask, a huge ask when you consider the uncertainty they are all facing. So what that looks like when we develop proposed activity around those priorities are, Andy's already mentioned the design and development of the Kickstart programme across GM. So we have to ensure that those opportunities and that support that is required actually meets the need of a wide range of our young people. We need to develop youth-friendly employment standards, for example. So that hopefully gives you sort of an understanding in terms of how we have listened and how we've worked up some draft proposals as we begin to shape the guarantee. And just finally, in terms of how we are moving it forward in terms of task force. So we've got the 24 group members as part of the advisory group, and we have now divided that group into 6, and each group is responsible for one of the 4 themes. They will work very closely with our partners in business and education, for example, who I mentioned earlier, and begin to either develop or challenge the proposed activity that we have worked up as part of a group. So our task force, in effect, are our businesses, our health providers, our educators, which is slightly different in terms of, if you like, the traditional way that we would expect a task force to work. But what the young people have said to us is it will be a bit ironic if we've asked them to lead the task force, but then we pass over influence and power to businesses and professionals who would then take ownership of the guarantee. I hope what that gives you is a sense of what we've been doing, how far we've come, and as I've described, that September is very much about identifying tangible commitments from our partners, and I think this is where the councillors, yourselves, and our other wider supporters can come in and really help promote what we need based on the consultation. Thank you.
I think it's the other way around, Diane. I think all of us are sitting there thinking, "Oh my God, we need to be thanking you." And I mean, Sean gave you absolutely the right introduction. You know, we're just so lucky that you're leading this work, and I think you've just shown that for us today. It's exciting, I think, that the voices of young people are really shaping this. You know, we don't know what it's like to have been them living through this. And I think the work that you're overseeing here is groundbreaking, actually. In the same way that Brenda has been working with disabled people through our Disabled People's Panel to make sure their voices are shaping our response to the issues they've raised, I think you're doing exactly the same. And in many ways, kind of taking some of the things that we'd already sort of created, like Gmca or the RPAS, but reshaping and making sure that they're right for what young people are calling for. And some of the insights you've shared today, I think already, I think are are important in making us think differently. So I just think this is tremendously important work, and actually devolution is about opening up that power, isn't it? Devolution is not passing power down to the likes of us, it's so that we can pass it down even further. And I think the sense of giving young people a sense of agency in this moment, i.e. they're not just sort of being victims of everything that's being done around them, but they can take some control here and shape things to help them move beyond this crisis, I just think is so important, and you framed this in such a powerful way. I don't know if any other colleagues want to come in. I'm sure I speak for everybody in warmly endorsing this, but if any other colleagues did want to make a quick contribution, that would be great. Brenda, please, and then Eamon. Oh, sorry, I should go to, if you don't mind, Brenda. Eamon first, I think, is also kind of linked portfolio holder. Then I'll come to Brenda. It's not, that wasn't age discrimination, Brenda, on the portfolio front there.
He's older than me, is he?
Thanks, Andy. And yeah, I think you're absolutely right. We do need to thank Diane and the team and the young people themselves for how they've shaped this, because I was a bit blown away by the amount that has taken place, despite everything going on. All these other distractions in life, all these other major issues that we've got to deal with. We've really managed to make, or the team have managed to make, some enormous progress, really positive. And I think it's just reinforcing that point that you've made, Andy, that, there's an old way of doing things, which is you start lumping in the solutions at the front, and, it becomes very sort of technical and a little bit, going through the motions. Here's what people want, here's what we need to do, this will solve it. Or even worse, actually, this will keep them quiet for the time being, and we can actually get on with doing everything else. And I think what we've seen actually by doing things this way, and you're absolutely right, that the work Brenda, Councillor Warrington is doing, reinforces that approach. Putting young people front and centre, giving them a voice, giving them influence, giving them power. It's not often talked about in that way, but if we really want to get what's best for our young people, that is the only real way of doing it. And so I just wanted to sort of reinforce not just the thanks for the work, but the approach that we're taking on this issue. We're throwing out the old way of sort of tokenistic gestures, I think, and we're moving towards a far better way of engaging on a whole range of fronts. And I think, just to make a comment as someone who sort of experienced a little bit of the previous recession and the previous economic upheaval when I was relatively young, I still think we're feeling the consequences of that. I still think we see the consequences of the approach at that time, forgetting young people, cutting youth services, putting pressure on schools and colleges, withdrawing the type of enabling support that Diane talked about, the missed opportunities around giving them the support to tackle the challenges in life. There was no talk of that last time. There was no effort at all gone into that, and I think this is the perfect way of responding, and I really do think it's going to produce some amazing results. So I didn't want to say much more than that, Andy, but just a big thanks to the team. Really reinforced the way we're going about this, and as you say, in a time when there's not much optimism and positivity, I think this is genuinely one of those things that we can make a real difference on, and so I just wanted to give my full support to it.
Great contribution. Thanks very much indeed, Eamon, and for all your work on it. So I'll bring Brenda in now. Brenda.
Thank you very much, Andy. Again, Diane, thank you so much for this report. It really is a pleasure to read, an excellent report, and certainly one that fits with the work I do as well, very much so. So thank you for all the work you do and the whole team. I just have a couple of questions, actually, because looking at the report, when we now are defining the young person as between 11 years and 30 years old, I mean, that is a huge age range. And if you take it to the extremes, You know, a person at 11 years old has got a very different outlook and view of life, haven't they, and needs to someone of 30 who may indeed, you know, they may even be married with children of their own, you never know. Whereas an 11-year-old is obviously still possibly just about starting the secondary education, etc. So I just wondered, how do you really take on board the views of such a massive age range with, you know, very, very different needs, I would say, or desires at each end of that particular spectrum? You know, as we come in the middle, I accept, but I just wondered how we square that one. But the other thing that I would ask is, on your advisory group that you told us about, what is the kind of maybe average age of the person that sits on that group, and how representative as a group are they of that age spectrum, if you know what I mean, the 11 to 30, and how do you manage that? As I say, simply because of the different demands that those age ranges would have. And likewise, from an equalities point of view, does the advisory group take into account gender equality, for example, race, faith, disabled, LGBT needs amongst the youth? You know, I mean, it is, how big does it get in the end? But I just wondered whether those kind of factors was something that had been considered, you know, when you're building this excellent team that you've no doubt got, in order to certainly talk about the future, because let's face it, you know, the future is theirs and they must have a say in it. So I just wondered. Thank you.
Good questions. Thanks, Brenda. Diane, I'll bring you in to summarise at the end if that's okay. But I had the Deputy Mayor, Baroness Beverly Hughes, who wanted to contribute, to stimulating a lot of thought here.
Yeah, thank you, Andy. It's great to just be able to say something in response to this report, and I very much echo what Sean and Eamon and Brenda has said. And I think it's absolutely fantastic for Diane to be leading it, because I think that will say so much to young people about the priority we're giving this. And as Eamon said, I really welcome the approach that's outlined in the report. I was going to say something that reflects a bit and goes a bit further than Brenda's point, really. And I know Diane gets this, but I just wanted to air it at the meeting. And that is to say that, you know, this group of young people, leaving the age range aside, will not be homogenous. Some of these young people will have started this period of time in COVID in relatively much more disadvantaged positions than some other young people. And therefore, in order to kind of make the difference to all of them, we've got to work a lot harder for some young people. Some young people might not feel able, without some support, even to participate in the opportunities that Diane and the team are going to open. And in order to bring them on to the same place to kind of assuage the impact of this COVID period, we've got to help them go further than some other people. And it's just to recognise that, you know, in helping all young people, we've got to go further and faster with some young people who, as I say, were already starting in a relatively disadvantaged position, and whose disadvantages will have been made more severe by this episode. As I say, I know Diane gets that. I just wanted to air that publicly. Thanks.
No, I'm glad you did that. So I'll bring Diane back in, and then I think Sean wants to come back in before we go to the recommendations. But Diane, some fantastic contributions that we've heard. So over to you, particularly Brenda's questions. I think we'll be interested to hear your answer to those.
Yeah, thank you for those questions, Brenda. And it was a challenge actually that we did have when we had to shortlist, but it was a nice challenge to have, if you like. And I've just managed to find my notes actually, because what we wanted to do was do what you suggested in terms of that age range. 11 to 30 is quite broad. Between the age of 16 to 18, we have 5 in terms of that age group. 11 to 15, we have 5. 19 to 21, we have 3. 21 to 24, we have 2. 25 to 30, we have 3. So what we wanted to do was from the outset make sure, or we wanted to make sure that we had a good base ground of how many that we were covering the whole age group. In terms of the average age, that might give you a sense of what the average age looks like. But then equality was a really important question that you touched on, and we wanted to make sure that the group represented Greater Manchester. And when we did then drill down and look at what we looked like there, we have got representation from mixed groups, Asian, Black and minority ethnic, we've got white representation. So in terms of ethnicity, gender and age group, we looked at that as part of our shortlist. We've got 13 male and 11 female, for example. So we've gone out of our way to ensure that what we do is have a representative group that looks like Greater Manchester. And hopefully we've done that. And if you do actually want to have a look at who's on the group, on the Young Persons Guarantee page on the GMCA website, there's some pictures and quotes of our young people that give you a sense of who they are. And in terms of your point, Beverly, that disadvantaged group and the marginalised group, what we've tried to do is recognise that on every level. So as part of the consultation, we know that a lot of young people wouldn't necessarily engage with, let's say, a live Facebook opportunity to come and tell us what their challenges are. So working with youth providers across the whole of the 10 boroughs, we've enabled and empowered them to build a relationship because they know their young people better than, say, I would or others. So we've done a lot of detached work, a lot of face-to-face work, one-to-ones, where we begin to understand with, let's say, that less motivated group or that marginalised group, trying to get a sense of what are their challenges and how can we build back stronger from a young person's point of view, because as we know, they are already disadvantaged across many different levels. Young people tell us they want to be safe in their environment. They want us to tackle the root cause as opposed to the symptoms. So we have to really understand what those challenges are by talking to them and looking at what the proposed activity looks like beyond that.
Sean, thanks so much, Diane. I'll wrap up in a second, but Sean, over to you.
Thanks, Andy. Yeah, and thanks. I'm glad that I was only brief because I don't think I could have done it justice in the way that Diane did. So it was an incredible presentation, and so much work has gone into this. I think the final comment from me, though, is just to reassure people on this call that this is a youth guarantee, but we're not losing sight of all of the residents who are impacted, because there is no doubt that this is affecting residents of all ages throughout Greater Manchester. And so that's why our full working skills recovery plan, that's what that covers. So this is a youth guarantee because we know that young people are disproportionately hit, but the GMCA is also working hard to support those that are affected of any age by the downturn in the economy caused by coronavirus. So that's the only reassurance that I want to give in following that discussion. If I just get people to cast their eye over the recommendations in the pack, it's on the page, I can't remember, page 76. You're asked to agree the approach to the emerging guarantee and comment on the scope, and I think we've had a very thorough debate on that, and also agree the implementation of the youth task force. So those are recommendations before you. Thank you to everyone for the contributions, and I hope that you will agree so this incredible work can continue.
Thanks so much, Sean. So, colleagues, those are the recommendations, as Sean said. Diane, just to say in closing, you've given us a much needed lift this morning, this afternoon now, with what you've said. It's just brilliant, the work that you're doing. And actually, to be honest, you've made a massive difference in the city region for years through the Diane Medal Sports Foundation. So, we know young people of this city region. You've been doing it for years, but now you're taking that kind of passion that you have up to a higher level. And you're putting all of your values into play here, which is just absolutely wonderful to see, and we're so grateful to you. So, colleagues, can I ask that the recommendations that Sean outlined be agreed? Thank you very much indeed. Item 9, colleagues, additional funding for dedicated home to school and college transport. Hopefully this can be a quick item. The government made funds available nationally to support the extra services that might be needed with the return of schools, both in terms of extra commercial services but also dedicated services. I think it was around £40 million nationally allocated. We received £2.25 million from that, and obviously we've been thinking about how best to spend it. As you'll see outlined in the paper, the vast majority of young people in Greater Manchester access school or college who go by bus, do so via the already commercial bus network. So the view of TFGM was that it would be right to use the money to supplement services on the commercial network to obviously provide for the capacity and hopefully then the safe distancing on public transport. So the proposals are outlined here, and you're being asked to note and endorse the approach to allocate the funding in this way. Concerns have been raised around a reference in the paper to some of the funding perhaps being spent on students outside of Greater Manchester. That's of course just because some of those services do bring students from outside to some of our institutions, places like Glossop or in the north, the parts of Lancashire, Rossendale close to Bury. So that just is obviously the way that the education system works. But colleagues, I think this is a sensible way forward. We're asking for your support today and the approach that I've outlined. Is that agreed? Excellent. Thank you, everybody. Moving on to item 10, recovering from COVID and tackling inequality, social value and public procurement. This is, I think, a really important piece of work that's been led by Councillor Alan Brett. This is about doing what we can without always saying to the government, what we need from them. This is about using the money that we have in public procurement in Greater Manchester to achieve some of the things that we've been talking about today, and particularly around employment, improving the quality of employment for all of our workers in Greater Manchester. So I'm going to hand over to Councillor Brett.
Can I very quickly, considering the time, agree the refreshed Greater Manchester social value framework and endorse the link between the framework and public procurement in Greater Manchester. Procurement is one of the keys, and when we come on to the next agenda item, I'll mention that again. So I formally move, Chair.
Thanks, Alan. So we're being asked to agree the refreshed framework and endorse the link between it and public procurement. I would just want to reiterate again, the Greater Manchester Good Employment Charter will be very specifically linked to public employment from a GM level, but I would hope that districts might be able to embrace that as well. We've all seen in this time how many people have been out at work, keeping the country running, but often they're living below living wage on insecure contracts. And I think we need to see an improvement in their standards of work coming out of this crisis, and the approach Alan is outlining will help us do that via public procurement. So colleagues, can we ask that that's agreed? Excellent, thank you very much. Moving on then, Alan, to item 11, Gm Cooperative Commission. Again, over to you.
Right, this is a vast document. I've had to do my own research to see how long since we started, January 2019. The first thing I'd like to do is thank all the members who were on the commission. They're all listed on page 145, so I don't need to say them in public. We should have done this a bit earlier, but obviously, like everything else, C19 has been a problem in getting things together. I want to say on the recommendations that we need now to follow up having done all this work. And one of the things that we need to do then is provide resources, not just in terms of perhaps some money, part of the industrial strategy, but in personnel, because the great way to get this matter forward is having some experts there or buying in the expertise. And we need to do it across all of Greater Manchester. And I know already there are great examples of cooperation going on, not least in most of the boroughs, but Manchester's got some particular examples, and I'm hopeful that one of the recommendations on setting up a zone in each area will happen in part of my borough in Middleton. We've even got a building here marked, and hopefully this will come to fruition. I know work's ongoing and there. I've also got in the borough, in another part of the borough, again in Middleton, a housing cooperative, which again has received quite a bit of help from Greater Manchester Authority. So, as I said, I want to do all that. One of the recommendations is that we should hopefully have all authorities join the Greater Manchester Cooperative Councils, and I hope that will be considered. The other thing is that in this time when things are at a low ebb for all business, etc., there's no better way of moving forward than cooperation. It's not a political thing, it's people working together, and therefore that's one of the reasons I recommend it very much so. I'd like to make special mention of something from Sean Fenson, who's one of the commissioners, and he's been very active because we've continued to meet since we did the report, and he is very interested in, obviously, in the digital section, and he wants us to really go for the digital ideas and to get things going. So I could go on and go on anything, because there's 42 practical policy recommendations, and I'm not picking any out. I want them all to be represented. I want us all to go ahead with them, and to enable smaller organisations to cooperate in the delivery of public contracts. And this is where procurement comes in. The issue of procurement sometimes is that because contracts are so big, it means that often local companies or even small companies cannot tender. And what we need to do is to look at tendering process and the procurement, and so I definitely want to take that one forward. As I said, digital is that. It's not my speciality. As you know, I'm not very technical. I always think it's the height of my expertise when I get online here. There, I can see David Molyneux smiling away there. He knows my expertise in this field. But I do think the recommendations need to be central to our economic recovery. And I suggest we bring a future paper which is being developed with that plan, which fits in with all the other plans. And sorry to have gone a bit, but I'll listen to any queries or comments.
Thanks very much indeed, Alan. You've led a fantastic piece of work here, and I think it's pretty groundbreaking, actually. I don't know if any colleagues do want to come in on this, knowing the issue and the commitment people have to it. I think that's indicative by no one wanting to come in, because we agree, Alan. I think the key is that delivery plan, isn't it, to back it up and to see some tangible progress on the ground. The zone you mentioned in Middleton, but perhaps elsewhere as well. You know, I think those are the kind of things we need to see, the visible sign of our commitment to the sector. Coming out of COVID, it's about community wealth building, isn't it, in a new age? And you know, the conclusions of the Commission will help us do that. So I've already said I support all of them. I support you in what you're doing with this. It will require resource put behind it, but the home of the cooperative movement needs to set out how the cooperative movement will embrace a 21st century future, and this report helps us do that. So colleagues, if I can ask for your support for what Alan said and for the recommendations. Excellent, thank you very much indeed. Conscious that some colleagues are having to leave, so we will move on quickly, if we may, on to the next item, which is working well. Approval of the variation to the scheme, which is some good news here, I think, and again an endorsement of the Greater Manchester approach, and that's down to you, Sean. Over to you.
Fantastic. Thanks, Andy. Yeah, it is indeed good news. So as part of the Chancellor's summer statement, it was announced that there'd be a variation to the devolved Working Well Work and Health programme that would enable the development of something called Working Well Light, which will offer support to those who have early support to those who have become recently unemployed. Just to some brief headline stats which demonstrate how impressive this will be. It's due to commence in early October of this year and complete in March of 2022. It's intended that it will support 13,200 Greater Manchester residents to find employment, and we've already received confirmation from the Department of Work and Pensions that we have been given £13 million in order to deliver this programme. So in recognition of the challenges in the economy and in order to support people early on before they become stuck in unemployment, we have been given this money to support people in Greater Manchester to get back into work relatively quickly. So it's another endorsement of our approach and of the great work that we've done over a number of years in Greater Manchester. The existing Working Well programme already has an excellent track record of supporting people on the fringes of the employment market or at risk of dropping out of employment. And the government's recognised that, asked us to do more and given us some more money in order to do it. So the recommendations before members today are to consider and note the updates and to approve the proposed variation which will expand the scope of delivery and allow the creation of the Working Well Light programme. And that's it from me, Andy.
Brilliant, Sean. I think this is fantastic, actually. I think 13,000 people, residents of Greater Manchester, might benefit from this, which is obviously a much more personalised package of support to help people get back to work, and we all know it's going to be needed, don't we, at this particular moment in time. So well done to you, Sean, and to all of our team that has built Working Well into a much more personalised and better approach to supporting people back to work than sometimes the national initiatives have achieved. I can't see any colleagues indicating. I think that says to me that there's strong endorsement for what you've just said. So, Sean, thank you. Colleagues, if I can ask for those recommendations to be agreed. And if we move on to item 13, the Mayor's Cycling and Walking Challenge Fund. Again, you're very, very familiar with what we're trying to achieve here, and the progress we're making on cycling and walking is really moving quickly now, isn't it? And thank you to all of you for the work you're doing to support the Challenge Fund, but also the temporary measures that colleagues have been putting in. So this paper has two particular items that we need to ask for your approval. There is one issue around full approval, full scheme approval for 2 schemes in Stockport, and then separately the release of 1.9 million for development costs for 5 other schemes in Salford, Manchester and Trafford. So I don't intend to delay the meeting. You know what we're trying to achieve with a major change to the quality of cycling and walking provision across Greater Manchester, building better communities, healthier communities. That's what we're all about. Again, very much needed at this time. Colleagues, can I ask for your support for the recommendations? Great, thank you very much. And then finally on to item 14, GM Housing Loans Investment Fund. This is the update report for 2019-20. Over to you, Paul.
Thanks very much, Andy. I'll try and be quick, but this is the annual update for 19-20 for the Housing Investment Loans Fund. Up until the 31st of March 2020, we're reporting on here in this report. Just for colleagues on the call, GMCA is requested to note obviously the position of the Housing Investment Loans Fund as at the 31st of March 2020, and obviously highlight there that there's been no requirement to account for any impairments in terms of how the fund operates, and also discussions that are ongoing with government to vary terms of the GM Housing Investment Loans Fund and provide further funds to GMCA and or remove the requirement for funds to be handed back at the year end to the government. Up until the 31st of March 2020, the combined authority has approved a total of 67 loan offers amounting to £508.3 million. 15 loan offers with a value of up to 75.7 million haven't actually been taken up, and the table at 2.1 in the report highlights the projects that have repaid funds are drawing down funds currently, or those that have been approved and yet to obviously draw down. And also colleagues will note that we've approved 2 equity investments amounting to 7 million up until the 31st of March 2020. Up until that date as well, in total we've seen 445.5 million drawn down from government, and 262.2 million over that period of time has been returned, leaving a balance for the combined authority of 181.3 million pounds. We are talking with government to try and retain as much of that as possible, and those conversations with government are ongoing. Colleagues will appreciate that the primary objective of the Housing Investment Loans Fund is to support Greater Manchester in meeting our housing objectives, and obviously what we're committed to in that fund is delivering 10,000 new homes over a 10-year period, and as it stands currently we are on track to deliver that. There has been a further emphasis in terms of how the loan fund operates to support schemes outside of the central business district, and you'll see within the report that 37 loans equating to 89 million is exactly supporting that outside of the city centre. We've also been supporting small medium enterprises, which is a really important aspect of this, and anyone who's familiar with the housing white paper in terms of tackling the broken housing market will know that that was one of the key emphases in terms of moving forward. We've established a small loans fund of up to £2 million to support SME house builders, and of the 52 loans approved prior to the 31st of March 2020, 32 have actually supported SME developers with schemes within Greater Manchester. The majority of those SMEs are Greater Manchester based, and we've provided 58.7 million of support to those SMEs. Importantly as well for us, 5 schemes approved prior to the 31st of March 2020 will deliver 131 affordable units, and in addition to that, £5 million worth of the equity is to invest into the Social and Sustainable Housing Fund, which is expected to deliver 80 social housing units. Since April of this year as well, the combined authority has approved a further 10 million of equity investment into 2 further funds, which again is supporting registered providers and charities within Greater Manchester to provide housing for vulnerable people within the city region. That will deliver 160 social housing units over the lifetime of the fund. And obviously this will complement GM's submission to the Next Steps Accommodation programme for tackling rough sleeping and homelessness. We've also delivered over we're expecting to deliver over 5,500 units supported by the fund through brownfield land. So that's already approved, and that's really good news because that demonstrates our commitment to our brownfield preference policy articulated in our plan for homes, jobs and the environment. And in addition to that, we're also supporting through this the town centre regeneration. You'll see in the report the 5 million for Stockport Interchange, 4 million for Rochdale Riverside phase 2 schemes. And colleagues will be aware as well, we've agreed a housing strategy, and part of that is about delivering truly affordable housing, bringing back into use empty homes, tackling road landlords within Greater Manchester, and creating a fund to buy out those landlords operating poor or unfit private rented stock. We are on with that, and we've established a delivery team using 1.75 million of the surpluses to enact a lot of the pledges we've made as a system within that housing strategy. And I think it's bearing fruits already, and you've seen that we've been successful with the 81.1 brownfield land funding money, 54 million shovel ready money. It's that development team that's helped us realise some of that within Greater Manchester. And just to finally finish on that, obviously, and one of the things I will be bringing forward to colleagues is the Good Landlord scheme in due course. And again, that delivery team has been instrumental in supporting the districts and working collaboratively across Greater Manchester to realise that aspiration of the system. There is other analysis in the report, but I think that's kind of the headline information, and hopefully that demonstrates to colleagues that we've moved away from solely, funding activity within the core of Greater Manchester to genuinely delivering on our housing strategy aspirations and pledges that we've all signed up to, and as is articulated in the strategy itself. So it's for you for a recommendation and noting, so happy to recommend it to colleagues. Thank you.
Thank you very much indeed, Paul. The floor's open if any colleagues would like to comment? If not, certainly good progress made, Paul, with regard to, as you say, spreading the money around all of the boroughs and providing more social housing for people with extra needs supported housing. So this is obviously the direction we wanted to see things go, and thanks to you for leading that. Colleagues, so if I could ask that those recommendations are noted, that concludes the business for this meeting of the Greater Manchester Combined Authority. A long meeting, but obviously we did have to discuss the very live issue that we've been facing. But I think progress has been made in the last few hours, and I think, as Sir Richard Lee said, we now need to plan for an exit strategy. You know, we have these interim restrictions in place. I think we now need to sort of be clear with our residents that we're planning to move beyond them, and that work really does need to start in earnest very, very quickly indeed. So I just want to thank all colleagues for the way you've supported each other and me and everyone through what has been a difficult few days, but we are very united, and I think with our unity comes clarity, and the government has now responded to that. So thank you, everybody. Some important business passed today. Again, thanks to Diane particularly for a wonderful presentation. Thank you all, colleagues. This is the meeting now closed. Thank you.
Hi.